Hello, my name is Anna Nowak-Wegrzyn. I am a professor of pediatrics at the Grossman School of Medicine at New York University and a director of pediatric allergy and immunology division at the Hassenfeld Children's Hospital. It is my great pleasure to present about Fair Patient Registry as a treasure trove of patient-reported outcomes. The disclosures that are relevant to my presentation is that I am an investigator in the FAIR Clinical Network. Our site is a clinical research center of distinction. My objectives for this talk are to introduce the food allergy research and education patient registry as a great platform for patient-reported outcomes research and to share an example of research that has been done with FAIR patient registry data to give you an idea what kind of projects you can establish within this source. FAIR patient registry gathers patient-reported outcomes. And patient-reported outcomes is an umbrella term that covers a whole range of potential measurements, but it specifically refers to self-reporting by the patient or caregiver. So the participants in the registry volunteer to answer the questions about their past history, about their experiences, the burdens of food allergy, but this is important that this is a self-reported outcomes. And this registry really offers a unique opportunity to hear directly from a large population of patients of all ages, from a variety of backgrounds across the US, because the registry at this point is available to the US participants and who all share their unique perspectives and really to tell us what it's like to live with food allergies. And this serves a very important purpose because this real world insight into the incidence and quality of life impact of food allergy then supports development of knowledge and tools and resources that are needed to accelerate advancement of clinical research and to build a pipeline of new therapies. A FAIR registry includes the following surveys. So, number one is the food allergy history. This survey collects information on patient demographics, current food allergies, recent reactions, comorbidities, symptoms, diagnosis, treatments, and tolerance. Another important survey is that of food allergy reactions. And this survey is very interesting because it delves deeper into patients' food allergy reaction, looking at the cofactors, the circumstances surrounding the event, as well as management and outcomes. What is very important to emphasize that the participants are encouraged to retake the survey for each reaction to study reactions over time. So this is not, so FAIR registry does not only contain cross-sectional data, but it also gives you access to longitudinal data as well when those patients come back and record it with new reactions. And then the third survey is that of mental health services and concerns. The survey assesses interest in and access to mental health support services for food allergy patients and caregivers to shed light on the psychological burden of food allergy. And if you're a clinician taking care of patients with food allergy, you have an idea how difficult this diagnosis can be for patients and for their families. So I think it's a very important area of research. An example of the research that can be done with registered data I want to share right now is a collaboration between Ruchi Gupta's team at Northwestern University, my team at Hassenfeld Children's Hospital, and Tam Kasali from FAIR. And the objective of this research was to characterize patient-reported biphasic reactions among children and adults who participated in this National Food Allergy Registry. Biphasic reactions are usually defined as a second wave of symptoms without re-exposures. And unless you ask specific questions, there's some information that is not always captured in clinical records due to limited time or just not collecting information in a very systematic way. So, really asking whether the patient experienced a second wave of symptoms, and based on my personal experience with, for instance, the number of epinephrine doses or that have been used for treatment of the reaction, if you don't ask that specific question, frequently the patient, the caregiver will not volunteer this information. So this may not be captured. The severity, exact severity of the reaction, as well as the treatments that have been used for the management of the symptoms. As a background, we know that the current estimates in the literature range very widely between 1 to 20% of reactions, anaphylactic reactions being classified as biphasic. However, those data are limited by the fact that the majority of those estimates are coming from individuals who are undergoing physician-supervised oral food challenges or physician-diagnosed anaphylaxis that is being evaluated in the emergency department. And at this time, very little is known about the prevalence of biphasic reactions outside of healthcare settings. For this research, we have used de-identified data from the registry's two surveys, a food allergy history and food allergy reaction survey. And the analytic sample consisted of parents and guardians of food allergic children up to 26 years of age, as well as food allergic adults over 18 years of age, so self-respondents. Um, so all variables were based on participants' self-report of the most recent allergic reaction to date. And it's important to emphasize that only one reaction was reported per participant in that study. The primary outcome of interest was the prevalence of biphasic food-related allergic reactions based on participant respond yes, no, unsure to the survey item. Did the participant experience a biphasic reaction, a second wave of symptoms 1 to 4 hours after initial symptoms subsided without repeated exposure to the allergen? And it's important to note that we are well aware that the range for the second wave of symptoms that is reported in the literature goes beyond 4 hours. However, for the scientific rigor, we chose to limit these reactions to appearing within 1 to 4 hours. And you could see the results. And I have to say that I'm presenting a limited version of the results just because the paper has not been presented at other venues and it's in preparation for publication. But you can see that we had a large number of participants, 3,789 participants who met the inclusion criteria into the survey, which represents 12.8% of children and 21.8% of adults in the registry who reported a biphasic food reaction. And I think it was very interesting, sort of illuminating for us to see that the patient-reported severity of the initial reaction was associated with the prevalence of a biphasic reaction. So the more severe initial symptoms were the higher likelihood of having a second wave of symptoms. And furthermore, the patient-reported severity of initial and secondary reactions were closely associated. So there is a significant correlation. So the more severe initial symptoms, then more likely that the secondary reactions will also be very severe. We were also able to identify specific food triggers, cofactors, as well as treatments that have been used by those patients at home, as well as later in the emergency room. So in summary, FAIR Patient Registry is a vital source of de-identified patient-reported outcomes in food allergy that is readily available for your research. It is important that all of us clinicians encourage patients to enroll and contribute to further diversify and strengthen this research tool. And patients are not compensated for participation. They really volunteer this information to sort of pay it forward to their community. If you would like to conduct research using FAIR Registry, you should definitely visit the website fairregistry.org to learn more about this resource and to register for access to the portal. And you should contact Dana Ward at gward@foodallergy.org to discuss conducting research with the registry, or if you have any additional questions about any future projects. So thank you very much for your attention, and good luck with mining the registry.